So the rule as we threw it up earlier on the pediatric dental is that it's one of the essential health benefits, which means every person employed in a business less than 50 or an individual coverage, in theory, was required to buy this pediatric dental benefit. Now, one very surprising exception to this, much to the ADA's dismay, is the government, as they were issuing the fine print here, about 3 or 4 months ago, they came out and said, if you're buying on the exchange, you don't have to buy the pediatric dental benefit. So even though it was declared an essential benefit and everybody's going to have it, well, now if you're buying on the exchange, you don't have to have it, okay? So that's a little bit different. But there's still going to be a lot of businesses, like I just described to you. Most small businesses are not going to be buying on the exchange because it's very unexciting to them. So all those small businesses are going to have a pediatric dental benefit. And I do think there may be a few more people coming to your offices now that have a dental insurance benefit than possibly what is on the past. But they're not required to buy it on the exchange, but those people buying off the exchange are still required. Yes?
So it'll be a dental insurance plan. We're not going to have to bill medical.
So the question is, it'll be a dental insurance plan. We don't have to bill medical. It is their medical plan, but you're still going to bill, my understanding from Blue Cross in particular, is you're still going to bill Blue Cross Dental just like you always have. And it's going to be on their medical card, though, okay? So here's the answer to your question, okay? So the pediatric dental benefit is going to largely mirror today's CHIP plan. The CHIP plan is the Children's Health Insurance Plan. It's the Medicaid plan for children. I want to emphasize this. The benefit will mirror the CHIP, not the reimbursement, okay? The reimbursement is not going to be Medicaid level. It's going to be based on the plan that the individual bought. So if the person bought a Blue Cross plan with the traditional dental benefit, then that's the reimbursement you're going to get, okay? Or if they chose to buy a standalone Delta Premier policy, then that's the reimbursement you're going to get, okay? But the coverages mirror the Children's Health Plan, which is pretty good coverage, actually. It's more than just, a prophy or two a year. It's actually, you can do some dentistry under that plan. It's the definition of a child is up to age 19. So everybody that under 19 is going to have this pediatric dental benefit. As I mentioned earlier, it does add to the cost of premiums. So you provide benefits for people, you have to have premiums to pay for them. So it's going to be, we've been hearing $20 to $25 per child per month, with a family cap, if you will, of 3 kids. So any kids more than 3, cheaper by the dozen. So it's going to be $70, $75 a month for 3 kids plus $20 to $25 a month. If someone has dental insurance already, so a lot of businesses, they have Blue Cross Health Insurance and then they have a Delta Dental plan. So if they can document or if they will attest that we have dental insurance already, then they don't have to double insure themselves and buy the pediatric benefit on their health plan, okay? Now, as I mentioned earlier, with the biggest design flaw from the ADA and the MDA standpoint, we were dismayed that they allowed people on the exchanges to not have to buy the dental benefit. One of the main fundamental problems with it, why the government decided to do that is, as you saw earlier when I put the subsidies up there, even the lowest poverty level, even if you're only making 10 grand a year, you still had to pay 10 to 15% of your premiums out of your own pocket. And so the concern was that if people already got to pay money out of their pocket for health insurance, are they really going to dig even deeper to buy dental insurance? If you're at that level, the poverty level, probably not. So would these people really be willing or able to pay for a pediatric dental benefit is the reason why the government ultimately backed down on that. So the question is Delta Healthy Kids going away? No. In fact, Delta Healthy Kids just got expanded by Governor Snyder, right? Yep.
So why would they have this if they because if you're that low?
So it doesn't, in a certain sense, it really isn't overlapping populations, okay? So those people that are eligible for the Healthy Kids Dental or the 133% or less of the poverty level, so then from 133 to 400 is what we're talking about here, okay? The My Child policy? So these standalone plans will probably compete with that plan the way you just described it. It sounds like, and ultimately one of them is going to be better priced and better than the others, and everyone's going to stay there or they're going to migrate over and start buying these plans depending on where they see a better price or a better benefit, it sounds like. Bob, did you have some? Bob Reynolds is our Blue Cross representative. I failed to introduce him. He wasn't here at the beginning, but go ahead, Bob.
The My Child benefit is for those people who make too much Medicaid, but they have not enough coverage, so they buy it's a CHIP program. Those programs are still going to be out there next year. So if somebody's eligible for that on the exchange will tell them, where their benefits are going to go. It'll direct them to the right spot.
It's just going to expand the companies that allow.
Because
right now,
I'm not sure if that the provider base is how that's going to change those plans for Medicaid and CHIP next year. But the pediatric dental benefit will be for those people that are buying or required to buy a qualified health plan next year.
So some of the practical concerns with the benefit, number one, and again, we just are starting to see these benefits now as of October 1st, but when we created this slide, we put down that it could be subject to high deductibles, and we are seeing that in practicality. So when there are some of the benefits where they're offering a pediatric dental benefit, but it's after the medical deductible. So which again, as we said, could be $2,000 or $3,000 for the benefit kicks in, okay? At this point, the benefit structure was not yet known. We now know it's going to mirror the CHIP plan, like I said earlier, and we also know that orthodontic treatments are not included as part of that benefit. Last slide, I think, here, and I think I already touched base on this. So it's not Medicaid reimbursement levels, it's the reimbursement level of the plan that your patient has. And it could be, anything from any company, and so you'll have to familiarize yourselves with what that benefit is and what they're paying and how to file the claim and all that. Chances are you're already dealing with that company somewhere already, filing dental claims. It should work real similar to what you're doing already. That's a great question. Comes up every time. The government's requiring us to do all this. Are they requiring us to participate? Do we have to see these children? And the answer is just like always, you choose your patient load and you are not required to see anybody. So the question is, do we have to make the necessary adjustment as par write-off? So again, we're getting in the gray area that this has never happened yet in reality, but my supposition would be if you're par with the carrier, you're going to get reimbursed your write-off rate. Yep. Right. Yep. Exactly. Yep. So, and it depends again, like it says here, on the plan or the network or what what the actual patient bought is going to dictate your reimbursement level and who they bought it from. So her comment was you might be forced to accept them as a patient if you're a PPO provider for that network. My understanding is not. So I mean, it would be no different than, you can only see so many patients in a day, right? So if everyone who's insured with Delta showed up outside your door one morning, I mean, you wouldn't have to treat them all, right? Right. Okay. So any other questions on pediatric dental at all? We're all around to answer your personal questions afterwards. We'd be happy to stay around and do that. And we thank you all for coming.